Hello, Dr. Christopher. It's very good to have you. You've been a friend of IFTC for a long time.
Sure.
It's good to have you again.
It's nice to be here.
Thank you. Can you introduce yourself to the viewers? Say a little bit about your work, about who you are, what you're passionate about, so they can get to know you a little bit.
Of course. I'm Christopher Rosik. I am a clinical psychologist licensed in the state of California. So I do primarily full-time clinical work, providing services to clients, usually adults, some adolescents. Mm-hmm. In addition to that, I have taught a research practicum at a local university, so I do research as well. I have a passion for that. Even if I don't get to do it as often as I would like, or can't dedicate as much time to it as I would like at this point. But so that's another part of what I do. I would say, and there's writing that goes along with it, of course, and coming to conferences. I'm a longtime member of the American Psychological Association. I'm in National Association of Social Workers, even though I'm not a social worker, but I've been affiliated with them as well. I don't pretend to speak for them, however, in these areas, obviously, but I am involved in those circles.
Mm-hmm. How long have you been doing therapy with clients?
Altogether, I started my work I was licensed in the state of California in 1988. Okay. So a number of decades.
Wow, that's
yeah. I'm too jet lagged to do the math here. So, but
right.
Yeah.
Mm-hmm. What would you say? Because I know this is a very controversial topic, even among people who are not very educated in the field. They would say that efforts to change someone's sexuality don't work most of the times. What would you say from your extensive experience about working in this field with your clients?
Well, yeah, there's multiple aspects to that question. What I find interesting is that it's pretty well established that sexuality does, for many people, change. There's a fluidity to it that happens in a naturalistic way. And so just on that basis alone, it seems to me it should not be that beyond the pale to think, yeah, in a clinical context, there may be things that could happen that would help a person experience at least some degree. And we talk about change always on a continuum of change, right? It's fairly infrequent that someone goes from exclusively homosexual attractions to exclusively heterosexual attractions, but many people may move on that scale up. And sometimes those changes are very, very meaningful and significant for them. So I would not, obviously, you want to avoid these grand generalizations and say everybody changes, or it's as grand to say nobody changes, but my point was that it is well accepted that change does occur in sexuality naturalistically. And it's kind of ironic to me that the only place where change cannot be facilitated or enhanced, perhaps, is in the clinician's office. It seems like that's quite an ironic thing. It's like, yes, it does change naturally, but if you actually see a therapist and seek assistance in pursuing that can't work. That can't be helpful. So just on its face, it seems to me to be not consistent.
You said that you also are doing some research.
Sure.
And I personally remember I watched a documentary some weeks or months ago. It was either What is a Woman or The Greatest Lie Ever Sold. I don't know if you've seen any of them. And there was a researcher in the institution that she used to work. She was sometimes given the results before having the research, and she was being told, you have to research in such a way that you get to these results, right? So apparently this speaks to me that because we're looking at research to formulate some conclusions. How do we make sure that the research that we're looking at is accurate?
That's a great question. I could sit here for an hour and talk about that. But it is a big problem, what you're alluding to. And what you just described is what we would call a questionable research practice. And the research that's been done about questionable research practices does suggest that this is a widespread problem within social science and in psychological literature in particular. And that includes things like, we add people to our sample until it's big enough where we get the result we want, right? Because sample size impacts the significance. The bigger your sample, the more likely you're able to find some level of significance to something, even if it's not really, clinically meaningful. But and then what you're talking about too is asking certain questions and looking just at those results and discounting a lot of other results that might not be as favorable as in terms of the results you're trying to get at, and that's a big problem. I do think a lot of the research in this area is conclusions in search of data, right? So the researchers have their conclusions, and now they're just out to find the data to support them, right? And it should be the other way around, where you look at your data, you do the research, you do the number crunching, and then, this is what it's saying, and you're not looking for predetermined answers, and one way to help do that is when you have a diversity of people doing research in an area from different and diverse perspectives, you're more likely to, I think, achieve some kind of consensus because one group is asking questions the other group's not asking, and they're bringing different data to the topic. And so from all that synthesis comes something that I think is probably much closer to the truth than if you just have one group of researchers who are all sharing the same assumptions about things, the same worldview, doing the research. Yeah, that's where we were talking some about that today.
Wow. So basically, we would not ideally have to stop at the first research that we find, but we should compare more sources and find consensus between them, right?
Yes, and you might have to look far to find those sources. There are a few out there. But yes, definitely, I think a certain level of skepticism is understandable in this field. At least in terms of this, a sense that this is the science. It's all settled. It's all concluded. I'd be very skeptical about that. That's not how science operates.
So for those who think that SOCI, which stands for Sexual Orientation Change Efforts, right?
Right.
For those who think that SOCI simply doesn't work, it's never worked, they look at those ministries that have been out there in the past, especially I think in the States, and they failed because they had maybe the wrong focus, I don't know. And they say that that's a proof it doesn't work, right? Like what do you think is a way for us to prove them the opposite, or to try to at least tell them that maybe they have been looking into the wrong data or the wrong research?
Well, there's some kinds, if you want to go broadly, what is SOCI, right? What are the specific practices that are associated with SOCI? I don't think anybody really has defined that very well. But if you talk about a practice like, aversive behavioral techniques or shaming people, that kind of thing, that's not going to be helpful. Right? So you could say, and they would, that if that's considered SOCI, then that is unhelpful, that's harmful.
Right.
But what I would be talking about is simply, speech-based conversations and helping a client, for instance, explore their history, their background, if they believe that trauma may have been a factor in their sexuality that they want to explore, then I think they should be allowed to do that on a speech basis, just talking about it. And there's no reason to believe that for some people that process is very helpful. I mean, there's certainly lots of anecdotal evidence, and I know that that's not the gold standard, but I mean, there's people here that would say that. And so I know that there are many more people that have had that experience than would go on the record as saying it, right? But I think that's the case. And those people, typically don't identify as LGBT plus, and so they are largely just ignored or just overlooked, right? So I think that allows the perception to be that it never helps anybody. It's always harmful. You know, anytime you hear a scientist talk about it's always or never, right? When I hear those words, I know this is an activist, not just or even a scientist, because nothing's settled, final in science. And some, most things are not, some people can find benefit in them, especially when we're talking about having therapeutic conversations with people. Not even the best therapy. I mean, the best gold standard kind of established therapy in the secular world has people who experience it negatively, right? Right. Yeah. So it doesn't always, cognitive behavioral therapy doesn't work for everybody, right? And again, those blanket words are just not. I don't find them useful at all.
I think you could practically say that maybe not every time, but in many cases it could also be like the expectations or the results could also be driven by the client's motivation or, reasoning in their hearts when they come for therapy.
Yes. I mean, it's not to say that if you just try hard enough, you're going to change. I don't think that's good language around it, because that doesn't always happen. But obviously a person has to be motivated to explore it in the first place and say, I want to see how my trauma might connect to my sexuality, whether working through issues of trauma might help me, in managing my behavior better, right? Or experiencing some degree of shifting in my sexual attractions or my gender incongruence.
So you would say that most of the times might come to therapy for having as the end goal change in their sexuality or the way they perceive sexuality, but then they find out that there are other underlying issues that they have to solve.
In my experience, most people aren't coming simply to doc, change my sexuality, right? But they're coming with a whole host of co-occurring issues, and we say, let's take a look at all of them and let's see how they may fit. And there's a sense in which issues of sexual identity, gender identity, at least for some people, I don't want to go blanket on this either, but some people, it's an expression of just identity issues in general. Right? Who am I? What am I about? How do I want to see myself in the world? And who do I want to become? These are broad identity kinds of issues, of which gender identity or sexual identity is a subset of that, or can be a subset of that anyway. So we're looking at the whole person,
very good,
right? And sometimes looking at that whole person, and you make some changes and address some issues, that it filters down into these other areas of a person's identity.
Yeah, that's very good, very good. What advice would you have for those young therapists, counselors, maybe teachers who are joining IFTC Learning or who are interested in the work that we do and enroll in any of our courses?
We need you. We need new young people to benefit from this training, to benefit from this information. You do have to have courage. You do, I think, have to have a heart for this area and individuals who are dealing with these issues. But I would say it's very meaningful, and once you get over your fear, there's a great freedom with it. Gosh, I can speak my mind. I don't have to keep it all in my head. I can talk to people about what I really believe, and obviously we want to do that in an intelligent and informed way, but there really is a sort of bondage with the self-censorship that's going on right now, even among many therapists I know. Tremendous self-censorship. They cannot be honest about how their thoughts and their feelings and beliefs in this area. And so once you get over that hump, where I will talk about it, I will learn about it, I will even affiliate with
IFTCC
and other organizations, that you're just released from that. And you meet all sorts of incredible people like you, Victor.
Thank you.
You get to meet many new and exciting, faces.
It's same reciprocal. I like what you said, because people like me who kind of share our testimonies in this area. We usually focus on those who are struggling with their sexual identity or gender identity, but we kind of tend to forget that there's the other side of people like counselors and therapists who struggle with just voicing their concerns and the fact that they cannot profess their profession properly and correctly with a clear conscience because the system is not allowing them to.
Right.
The fact that you said that just getting over your fear brings a level of liberation.
I did a study on this probably 10 years ago now, surveying a Christian association in the States, and there was upwards of 60% of the participants in the study that said they were self-censoring on these kinds of issues. So that's a huge problem.
Well, hopefully things will change. And
well, yes, but it changes by people having courage, right?
Yeah.
And you could say faith, the faith and courage of their convictions. You have to count the cost, but like I said, the benefits are tremendous once you are free to speak your mind. Again, in intelligent ways.
Yeah.
Just because a person has a microphone doesn't mean they're a good speaker.
Yeah.
You know, sometimes people represent this work in ways that do more damage than our benefit, but because they're not as informed as they think they are.
Yeah, it's very valuable. Thank you very much, Dr. Christopher, and I really appreciate that you took the time and energy to be here.
Thank you.